Hello everyone, welcome to this video. In this video, I will discuss about theory-based of cultural consumption to reduce the recall and projected in healthcare system and in education system. And this is also my essay topic. And in the essay, I will talk about the introduction about some basic theory about cross-cultural consumption training, and this can reduce the recall and show the cultural consumption is negative correlate with the projected. Also, this essay will discuss some cultural consumption training in cultural physiology class and explore some effect of the student when they learn the cultural physiology, and is also used in healthcare setting to show the increasing of cultural consumption can reduce the projected. First, we will discuss some basic theory of cultural consumption. First is about social and emotion consumption. This is full name is Collaboration for Academic, Social, and Emotional Learning Model, and this model is based on five components from people, and this five is self-awareness, self-management, social awareness, relationship skills, and responsibility decision-making. And these five components can get into three parts. First part is for social, and social is about the social awareness and relationship skills. And this can describe the people's abilities in social. And the second part is about emotion, and emotion is get included in self-awareness and self-management for themselves, and they can describe themselves and get the emotion. And the third part is the last part is about a relationship and responsibility, learning skills. This can get into three parts. And the international cultural component is described about the intercultural sensitive, and we will should get different for the intercultural conception, right? First, but actually it's hard to describe that. First is because the ability first be decreased in the intercultural is about the ability to communicate effectively and appropriate in intercultural situation based on one's intercultural knowledge, skills, and attitude. But the now get changed because the culture is even changed. So the model should also get changed by that. So we get 4 tips to describe the change of the intercultural conception. First is it lead to awareness of social controls of culture. And the second part is to define whether the categorized is self-expressed or described by others. That can describe the culture. The third part is the culture is categorized by the varieties and interdependent. It can be understand the interdependent. And the first part is recurse and extend focus on issues for proof and emotion. And this part is can describe in 3 parts. And this is whole model for that one. And it has 3 parts for social conception, emotion conception, and international culture conception. But because in our topic, we will discuss about prejudice and reforms, but actually it's easy to discuss you get prejudice or not and can test your cultural conception, and it can describe about that. So we get describe about cultural consumption. Culture reduce is about the ability to indeed create a perception or belief about culture. That is for polarizing, and this is actually described about anti-discrimination, but other sides can describe about prejudice. And the second one is about the ability to recount the place and power structure in society. And the other part is about the ability to understand the intersection and the fruit of culture. And we can use this to describe you get prejudice or not. And another part I want to talk about is cultural psychology class. And they get some question to ask question. They ask such as cultural psychology encourage students to become more conscious awareness or on content, Or you ask about the increased or emotionalized group intelligence or prejudice, and this can describe about the what people learn from the psychology class and what do they feel about the conception, and did they will get prejudice from them to other or others to them. And this is easy for test, but actually some students who not receive the high grade, they get increase the synthesis from the cultural psychology research, and they will increase the possible they get prejudice or claim to others. And the last part, we will talk about the cultural consumption and reduce the prejudice in the healthcare system. And this research is happening in American and is described about patients complaining to prove cultural consumption to direct influence patient health outcome through process of care. And that can be described by the cultural testing. And by our test, we can find out their cultural conception from the nursing or doctor, and it can describe the gates prejudice or not. And for other sides, the cell pain from first model is happening in European, but it's not for whole world, so it's get limited for just the European people. And the other two different difficulty to defend the intercultural consumption, because we know that it's a movement and not stable, so it's hard to describe that. And third one is about some limited for other two research. First research is only happening in North American and it just small scale undergraduate lecture course question and example. So it's not for everyone, and it just can show the tips of how this is working, but we can find out why it's working. That's based on the model. And, and the other side is the other research is about American people in nursing care, and maybe just only in American people, not for other ones such as Australian health, not happen in Australian healthcare. This is based on American culture, so that's the limit for the last two research. And in conclusion, in this training and such as physical class and the cultural training healthcare system have negative credits for prejudice. That's what we found, as it still have some other sides and it will increase the services for students, for example. And that's all I want to introduce. That's the reference date. Thanks for watching my presentation.